Hi there, my name is Anna. I'm a kinesiologist, clinical exercise physiologist, rehabilitation scientist, and mother of 5. And I'm here today to show you how to do a proper core activation. This is a question I get asked a ton, and this is something very simple, very safe, very easy that you can do right after you've had babies. You can do it right after you've had surgery. You can do it if you've been suffering from low back pain. This is a great exercise to learn. This is a good exercise to learn in general to keep you safe while you're doing any kind of activity. So we're going to work with our breath and with learning how to properly brace our abdominal muscles. And this is really going to be a building block for a lot more complicated exercises later on. But again, let's start at the start. Let's start where it's simple and safe. So you can do this lying down. You can do this seated. I'm going to just stay in this cross-legged position for a while because I'm going to be talking for a bit. But I want you to, whether you're laying down or sitting, I want you to kind of feel into the nice soft parts of your tummy there. And we're going to inhale through the nose and then purse our lips and slowly exhale through the mouth. And let's just take a couple breaths like that to bring some awareness to our abdominal muscles and how related they are to our breath muscles as well, to our diaphragm. Inhale through the nose. Exhale slowly through the mouth. And our tummy should be nice and relaxed. Inhale through the nose. Exhale through the mouth. Now the next time we do this, I want you to think about creating some tension underneath your fingers with your abdominal muscles. You're not going to be sucking anything in, you're not going to be gripping, you're not going to be moving anything. You're just going to be firming up and tensing, kind of like you're getting ready for a small child to come poke you in the belly button. So you're going to do that on the exhale. We're going to inhale and exhale. Create some tension under your fingers and see if you can hold that tension while you inhale and exhale again, nice and gentle. I'm going to lay down and we're going to do this again. It is a little easier to find those muscles when we're laying down. It's a little easier to relax. We're going to feel in through that soft, nice soft tummy. We're going to inhale and exhale. Create that tension under your fingers. Hold that tightness while you breathe normally for a couple breaths. Nice gentle tension. We're not gripping as hard as we can here. It should be a gentle underlying tension. Relax your shoulders. Make sure you're not squeezing your butt. You're not clenching your cheeks anywhere. And relax. Now, you can just practice this with the breath and the hold for 3 breaths or so. You can just practice doing that. That's a perfect place to start. We can make this a little more difficult as we start to feel better and as we start to feel ready for a bit more of a challenge. You can exhale, activate, activate that tension, and then slowly bring out a leg, straighten it out, hold that tension equally underneath your fingers, and slowly bring it in. Make sure you're still breathing and relax in between. Okay, we're going to do it again. Activate on the exhale. Nice tension, and slowly bring your other leg out. Okay, and you can play around with making it even harder. Play around with trying to do a foot touch with both feet. You can try doing a straight leg and bringing that up and down. What we're trying to do is we're trying to train those abdominals to brace and keep our core nice and safe once we start to do more complicated exercises. And we do that by working with our breath and training this gentle activation. Later on, we can start to make this more complicated by adding in some pelvic floor activations, but this is where we're going to start. It's safe, it's simple, it's effective. Obviously, if you're having any issues with this, you're going to want to seek help, but otherwise, have fun.